Welcome to the deep dive. Today, we're really digging into the Indian healthcare scene, specifically the hospital industry.
Yeah.
And based on these, pretty detailed reports we've looked at, it's clear healthcare is huge for the Indian economy, massive in terms of revenue, employment.
Absolutely. It's not just a side thing. It's central.
Hmm.
And it looks like it's set to grow even more. The market's already worth, what, hundreds of billions in US dollars?
Exactly. So to really get a handle on where things stand now and, where they might be heading.
We've basically been mining these two recent, really comprehensive reports that break down the hospital sector, financials, growth plans, the whole competitive scene, key players.
Right. Think of this as us doing the heavy lifting.
Yeah, sorting through it all.
Our mission today, for you listening, is to pull out the absolute key insights, the stuff that really matters about India's hospital industry now and in the future, without burying you in jargon.
Exactly. Cut through the noise.
Okay, let's unpack this. Maybe start broad. Like overall healthcare spending, the government's role in all this.
Sounds good. So globally, healthcare spending hit this enormous figure, USD 9 trillion, back in 2020.
9 trillion.
Yeah. And the breakdown's interesting. About 63% of that came from governments. Private sources were around 36%, tiny bit from external aid.
Okay. And how does India fit in?
So India, in calendar year 20, its total healthcare spend was about 3% of its GDP, its gross domestic product.
3%. Now, I have to ask, is that high? Low? Average?
Well, that's the thing. When you compare it internationally, even against other developing countries like Brazil, Nepal, Vietnam, Sri Lanka, let alone developed ones like the U.S. or U.K.
Yeah.
India's spending as a slice of its economy, it's actually, lags behind quite a few.
Interesting. So maybe not as much as you'd expect relative to the economy size.
Right. But what is noticeable is that government spending did increase, and that was a big reason total health spending grew between 2019 and 2020.
Okay. So the government is stepping up its contribution.
It seems so, yeah. Per person, government health spending went up. It grew faster than previous years. It suggests, a growing recognition that the government needs to play a bigger part.
But there's another side to this, isn't there? The amount people pay directly out of pocket.
That's really high in India. Yeah. In 2020, it was around 51% of current health spending.
51%?
Yeah, that's way higher than the average for lower middle income countries. Puts India among the highest globally for direct individual spending on healthcare.
So even with more government money coming in, individuals are still carrying a massive chunk of the cost themselves.
Exactly. It really highlights this potential gap in how effective insurance coverage is for a lot of people, despite the government pushing schemes.
Right. You mentioned schemes. The government is trying to expand insurance, correct?
Yes, definitely. There are several initiatives. Ayushman Bharat is the big one.
Yeah.
But also state-level schemes, the employee state insurance scheme, the central government health scheme, all aiming to get more people covered.
Okay. Let's pivot a bit then to the hospitals themselves, their financials, their growth. What are the reports saying there?
Well, some positive signs. Hospitals seem to be improving their debt situation. Debt metrics look better.
And why is that?
Mainly because they're making more money per bed. That's the average revenue per occupied bed, or ARPOB. And they're keeping more beds full, so occupancy levels are up too.
Good for their bottom line then.
Definitely gives them a stronger financial footing. And looking forward, they're planning a big increase in beds. Maybe around 30% more capacity by fiscal 25.
30%? How are they doing that?
It's a mix. Some are building brand new hospitals from scratch. That's the greenfield expansion.
Okay.
And others, especially the bigger players, are buying up existing hospitals. That's the inorganic acquisition road.
Got it. And the hospitals listed on the stock market, are they seeing good revenue growth?
Yes. Quite strong, actually. For the main listed players, their combined revenue grew at about a 12% compound annual growth rate, CAGR, between FY19 and FY23.
12% average annual growth, basically.
Pretty much, yeah. And that came from more patients coming in, about 7% CAGR for inpatient volume, and also that ARPOB figure increasing, about 5% CAGR there.
Okay.
But what's interesting is that some of the smaller players, KIMS, Rainbow, HCG, Shalby, Medanta, they actually grew their revenues even faster during that time.
Oh, really? Why do you think that is?
Hard to say for sure, but maybe they're more nimble, or perhaps have a stronger focus on specific regions or niches that are growing quickly. It suggests size isn't the only factor.
Definitely a dynamic market. Okay, what about profitability? Margins, earnings?
Yeah, the reports look at EBITDA margins, that's earnings before interest, taxes, depreciation, amortization, a core profitability measure.
Right.
and also EBITDA per operating bed. Helps compare efficiency.
Yeah.
And there's quite a bit of variation.
Okay, like who's doing well?
Well, you got Rainbow, Kim's, Max, Medanta, Apollo. They're showing pretty healthy EBITDA margins, sort of in the 25% to 35% range.
That sounds pretty good.
It is. But then others like Fortis, HCG, Noriana's India operations, their margins are lower, more like 18-19%.
And who leads on that profit per bed metric?
That would be Max Healthcare. Because they're so concentrated in the big metro cities where prices and complexity are higher, they're pulling in the highest EBITDA per bed, around 5 million INR per operational bed.
Right. Location matters. And it sounds like these companies aren't just sitting still, they're planning more growth.
Oh, absolutely. Aggressive expansion plans seem to be the norm. Most are aiming to increase their bed count by anywhere from, say, 30% to even 90% over the next 4 or 5 years.
90%. That's huge.
It is. Max Healthcare's plan is particularly ambitious. They're looking to add something like 300 to 400 beds to their current base of 3,500, doubling down, essentially.
Wow. Betting big on future demand. Okay, let's shift gears slightly. Talk about the demand for hospitals versus what's actually available. Is there a mismatch?
A clear mismatch, yes. The reports really emphasize this. There just isn't enough hospital infrastructure for the demand.
Uh-huh.
And on top of that, there's a shortage of skilled medical staff, doctors, nurses, specialists.
So not enough beds and not enough people.
Exactly. And those two factors are really what's pushing these corporate hospital chains to expand like we just talked about. Plus, a lot of the existing hospital beds are quite old. Mature is the term used. So, need for new facilities too.
It puts those expansion plans into context then.
Definitely. They see a clear gap to fill.
And are they just building more in the big cities or expanding elsewhere too?
That's a key trend. They're moving beyond the metros. We're seeing a definite push into Tier 2 and Tier 3 cities, smaller urban centers.
Okay, like who's doing that?
Well, Kim's, for example. Big plans in Maharashtra, Bengaluru, Kerala. Max is looking at places like Nagpur, Punjab. Medanta's already in Lucknow and Patna. Astercare, Jupiter Hospitals. They're also targeting these areas.
Makes sense. Go where the growth potential is, maybe less competition initially.
Potentially. And for some, like Kim's, a huge chunk, like 80% of their planned new beds, are actually going into these Tier 2 plus cities.
Right. Now, India often gets talked about as a value destination for healthcare, right?
Yeah.
Medical tourism.
Yes, that's another important angle. But it connects back to that infrastructure point. India actually still has fewer hospital beds per person compared to global benchmarks.
Oh, really?
Yeah, the figure mentioned is around 9 beds per 10,000 people, significantly lower than many countries. Same story for doctors and nurses per capita, below the global median.
So even with all the growth, still underserved domestically in some ways.
In terms of sheer numbers, yes. But within that context, India has become this value healthcare destination.
Why is that? Just cost.
Cost is a huge factor, yes. But it's not just cost, it's also the availability of highly skilled doctors and nurses, access to modern technology, and crucially, a growing number of hospitals getting international accreditation, like from the Joint Commission International, JCI. That signals quality and safety.
So it's the combination: skills, tech, accreditation, and lower cost.
Exactly. That package makes it very attractive for patients coming from Southeast Asia, the Middle East, Africa, neighboring countries, people looking for quality care they might not find at home or can't afford elsewhere.
Like a global healthcare value proposition.
Yeah.
Where do most medical tourists come from?
The biggest source country right now is Bangladesh. They account for a really significant share, probably due to limitations in their own advanced healthcare system.
Oh, okay.
Though the reports do flag a potential risk there. Political uncertainty in Bangladesh could, potentially impact the number of medical visas issued. That might affect chains like Apollo, Nariana, who see a lot of patients from there.
Right, something to watch. And India does well on those JCI accreditations.
Very well. Ranks among the top countries globally for the number of JCI-accredited hospitals. It underscores that commitment to quality.
And the cost savings are real.
Oh, yeah. Quite dramatic for certain procedures.
Yeah.
Things like hip replacements, knee replacements, heart bypass surgery.
Yeah.
Significantly cheaper than global averages. And the good news is, international patient numbers seem to be picking up again after the pandemic travel slowdown.
Okay. Let's talk about how people in India pay for healthcare. Insurance is key, right? But we touched on the high out-of-pocket costs.
Right. So insurance penetration has been growing, reached about 41% in FY24, according to the reports.
It sounds okay.
But
yeah.
A huge chunk of that growth, over half, comes from those government-sponsored schemes like Ayushman Bharat.
Okay. And the issue there for the hospitals is?
The reimbursement rates. The amount the government pays the hospital for treating a patient under these schemes is often heavily discounted compared to what a private or cash-paying patient would pay.
So more people covered, but not necessarily bringing in the same revenue per patient for the corporate hospital.
Exactly. Ayushman Bharat, for instance, massive scheme, huge budget, millions of cards issued, lots of hospitals signed up.
Yeah.
But the price difference for, say, a common surgery under the scheme versus paying cash can be huge. Discounts can range from just a bit to like 50% or even nearly 60% sometimes.
Wow, that's a big difference.
It is. And because regular retail health insurance, the kind people buy themselves or get through employers, still isn't super widespread.
Right.
That high out-of-pocket spending persists.
Yeah.
People are still paying directly for a lot of their health care.
Okay. So looking ahead, how might things like rising incomes or changing disease patterns affect hospitals?
Well, the reports suggest that as incomes rise and lifestyles become more, well, urbanized and perhaps sedentary,
Yeah.
we're likely to see more non-communicable diseases, NCDs. Think heart disease, diabetes, cancer.
The kinds of things that often need more complex, ongoing hospital care.
Precisely. And at the same time, people seem to be spending a bigger share of their overall budget on health care. That's measured by private final consumption expenditure, or PFCE. Healthcare share is going up.
So more chronic diseases needing care and people allocating more money to health sounds like a recipe for continued hospital growth.
It definitely points in that direction.
And how has their actual financial performance been recently? Profitability, returns?
Generally improving, according to the reports. Profitability, return on investment, looking better in recent years. We saw those positive CAGRs for revenue per bed and also for EBITDA per bed that's using the pre-INDS accounting. But the trend is up. EBITDA margins improved, return on invested capital, ROIC, also improved quite a bit.
That sounds positive.
Yeah. And another interesting point is that a lot of the new beds being added are through brownfield expansion, adding on to existing sites.
Ah, less risky than starting completely new projects.
Generally, yeah. Lower execution risk.
Yeah.
So overall, the expectation is that Indian hospitals are probably set to grow faster than their global counterparts.
Okay, paints a fairly rosy picture. But surely there are challenges, risks on the horizon.
Oh, absolutely. No industry is without them. Regulation is a big one.
Like what?
Things like potential price caps on procedures that conversation keeps coming up. Also, the ongoing implementation and impact of the Clinical Establishments Act. Lots of uncertainty there.
Okay, regulatory hurdles. What else?
Competition. Definitely heating up as more players expand. And the rise of single specialty hospitals could challenge the big multi-specialty chains in certain areas.
Right, focusing on just one thing, maybe doing it cheaper or better.
Potentially. And maybe the biggest challenge highlighted is staffing.
We mentioned the shortage earlier.
Exactly. A persistent shortage of skilled doctors, nurses, technicians. And high attrition rates, people leaving their jobs.
Which impacts quality and costs, presumably.
For sure. Harder to maintain quality care and drives up labor costs trying to retain people.
Yeah.
Significant headwinds.
Definitely challenges to navigate. Now, the reports also zoomed in on some specific hospital groups. Let's start with Rainbow Children's Medicare. What makes them stand out?
Rainbow is fascinating. They're a leader in a very specific niche. Pediatric healthcare, children's medicine.
Okay.
But it's comprehensive, including really complex, high-level coordinary care, plus related services like obstetrics and fertility.
So very specialized.
Very. And their financials often look better, unit by unit, compared to typical multi-specialty hospitals. Partly their model. They use an asset-light hub-and-spoke system. A main hospital supports smaller clinics, and their cost per bed, the capital needed, is lower.
Interesting.
So even though their overall occupancy might be a bit lower because they have more critical care beds, which aren't always full, their return on investment is higher, and they get more revenue from outpatient services.
So that focus and efficiency pays off.
It seems so. They really dominate the infrastructure among standalone children's hospitals. Their expansion follows that hub-and-spoke model in different clusters. Hyderabad, Bangalore, Chennai, AP, Delhi, NCR.
Right.
And apparently their spoke clinics can break even quite fast, maybe just 12 months sometimes.
Impressive.
Especially when you remember that general shortage of doctors and nurses we talked about. It's even worse in pediatrics.
Ah, right. So their ability to attract and manage staff in that niche is key.
Must be. Analysts expect solid revenue growth from both their established and new hospitals. They generate good cash flow, too.
Any downsides or risks mentioned for Rainbow?
The main one seems to be concentration risk. A very large portion of their business is still clustered in and around Hyderabad.
Okay, reliance on one main region. Got it. Let's talk about KIMS then, Krishna Institute of Medical Sciences. What's their story?
KIMS is primarily South India based. Their big focus is on affordability and building really strong connections with their doctors, especially in those tier 2 and tier 3 cities.
So different geography, different focus than Rainbow.
Yeah, strong brand, very dominant in their home turf of Andhra Pradesh and Telangana. But like others, they have big expansion plans, Maharashtra, Bengaluru, Kerala, adding lots of beds.
And how are their financials? You mentioned them earlier as having good margins.
Top-tier profitability, yes.
Yeah.
The reports put it down to really smart cost management, lower than average capex per bed,
Okay.
and this quite unique doctor equity model. Plus, a lot of their patients pay cash, self-pay.
Doctor equity model. What's that?
Essentially, they give doctors an ownership stake, equity, in the hospitals they work in.
Oh, interesting. So the doctors are part owners?
Effectively, yeah. It really aligns incentives, helps attract and keep good doctors, especially when talent is scarce. Probably helps keep staffing costs down, too.
Clever. A way to build loyalty and maybe improve performance?
Seems likely. And as mentioned, their capital spending per bed is relatively low. They often buy land next to existing hospitals and build their own facilities tailored to their needs, keeping that affordable model going. They've also brought in new leaders specifically for these expansion regions.
So value focus, strong doctor partnership, efficient operations.
That seems to be the KIMS formula. Analysts expect strong growth in revenue, EBITDA, profit.
Any risks flagged for KIMS?
A few, yes. Potential delays in getting their new hospitals built. Greenfield projects always have risks. Increasing competition in their markets. And also the fact that the promoters, the main owners, have pledged some of their shares as collateral for loans.
Okay, things to keep an eye on. Now, before we wrap up the company specifics, maybe a quick word on Max Healthcare and Medanta. We touched on them, but any other key points?
Sure. Max, as we said, dominant in metros, tier 1 cities, a big focus on complex surgery, especially cancer care, oncology. That drives their higher ARPOB.
Right.
Their expansion strategy is often more asset light, focusing on operating and managing hospitals rather than owning the buildings outright. Industry-leading profit per bed, huge presence in Delhi NCR.
Got it. And Medanta.
Medanta has this really strong, distinguished brand, kind of a destination healthcare model.
Yeah.
People travel there for difficult cases.
Okay. Attracts patients from further afield.
Exactly. They typically operate very large hospitals. Big expansion plans, too, which, as the reports note, might put some pressure on their margins and returns initially as new capacity comes online.
Makes sense.
They're also focused on medical tourism pre-COVID. International patients were a decent chunk of revenue. They expect that to come back. And they have major hospitals in places like Lucknow and Patna, the largest private ones there. Their model really emphasizes clinical excellence, and they involve senior doctors heavily in management decisions.
Fascinating. It really shows the variety, doesn't it? Different strategies, different strengths across these major players.
Absolutely. It's not a one-size-fits-all market at all.
So, if we were to summarize this whole deep dive, what are the main takeaways for our listeners?
I'd say first, the Indian hospital industry is clearly poised for significant growth. Demand is strong.
Okay. Growth is happening.
But it faces real challenges. Regulatory hurdles, that skilled manpower shortage we keep mentioning, those are significant.
Right. Not without bumps in the road.
We're seeing consolidation, bigger groups getting bigger, and this strategic push into tier 2 and tier 3 cities. That's a major trend.
Expansion beyond the metros.
Exactly. And as we just discussed, the different players have very varied financial performance and strategies. Plus, you have the rise of specialized care, like Rainbow, and the ongoing potential of medical tourism, adding other layers.
Okay, a complex but growing picture. So maybe a final thought to leave our listeners with. As we see this increasing privatization, this focus on specialization, these different corporate strategies, what's the future balance going to look like in India between making healthcare accessible to everyone, keeping it affordable, but also delivering that high-quality specialized care that people increasingly want?
That is the multi-billion-dollar question, isn't it?
It really is. And it's fascinating to think about how the different approaches of groups like Rainbow, KIMS, Max, Medanta, how they're all trying to navigate that exact challenge in this evolving landscape.
A lot to watch in the coming years.
Indeed. Thank you for joining us on this deep dive.